Okay, wrist and hand objective assessment. So as with every other joint, we're looking first of all observations for any deformities, any signs of swelling, any colour changes, any signs of heat. So we're looking down through the wrist extensors, the wrist flexors. We're looking at the wrist itself, so we're looking at the collateral ligaments. Because the wrist is quite superficial and all the ligaments are and all the joints are, and the hand, you're generally going to find if there is any swelling that it's going to be pretty obvious. So just turn your hand over that way. Again, looking through the thenar eminence, looking through the hypothenar eminence, through all the fingers, all the volar plates and the collateral ligaments, just generally seeing if there's any difference between sides. Okay, looking up through the wrists again, through the flexors and extensors. Okay, that's fine. Back down. Palpate for heat. Start with the back of the hands. Okay, again, just checking any difference between sides. Turn your hands over. Okay. Palpation of all the structures, significant structures. Again, start with wrist extensors. Come down. Radial collateral ligaments. Wrist flexors. Ulnar collateral ligaments. Pisiform through to your scaphoid. Thenar eminence, hypothenar eminence, come down through your metacarpals, and obviously individual phalanxes as well. Turn your hand over, dorsal side, so stylo processes of radius and ulnar, again collaterals, dorsal ligaments. Okay, you do that both sides. First of all, active tests. We've got 6 movements of the wrist, so we're going to get them to do active tests for all 6. Keep your elbows fixed, and I just want you to bring your wrists up like that. Looking for equal range of movement, looking for ease of movement, and again looking for any signs of pain or discomfort. Back down. Radial deviation, so again bring both fingers in towards each other like that. Keep the elbows still, good. Again looking at relative level ranges of movement. Back to the middle. Ulnar deviation. Again, that looks pretty similar, back to the middle. Okay, he's already in a pronated position. Turn your hands over. He's just on active supination. And now from there, just bring your hands up towards your wrists. You can see there's a slight difference there between sides. So this one flexes a little bit more than this one. Back down. He's in a supinated position, back to there. He's now done active pronation. Passive tests. Do the same 6 movements passively. Just fix the wrist, so the radius and ulnar. Have the heel of my hand on the metacarpals. I don't want to be on the phalanxes, because if I do that, I'm looking at finger extension. So I'm trying to get my heel of my hand on the palm of his hand, fix the radius and ulnar, and extend. Again, you're looking to get to end of range. It should be around 90 degrees, so you can see that's good. Same on this side. Ulnar and radial deviation. While he's in this position, I might as well do as much as I can. Grab his hand as if I'm shaking his hand. Fix the radius and ulnar, and again, ulnar deviate. Come to the opposite side, ulnar deviate. I was in this position, so to radially deviate, switch hands, radially deviate. Again, when I'm doing these tests, common sense would tell me, as I radially deviate, I'm stretching everything on the outside, so all the lateral collateral, all the ulnar collateral ligaments, all the ulnar deviators, so anything along this side I'm stressing. When I do ulnar deviation, it just makes sense that anything on this side I'm stressing as well. This side as well. Okay, turn your hands over, flexion. Again, making sure that I'm not flexing the fingers. I'm trying to flex the wrist joint itself, fix the radius and ulnar. To end the range, got a good elastic end field. Good elastic end field. Pronation and supination. Start with his hands in midpoint between fully supinated and pronated. Again, grab the hand as if I'm shaking his hand, fix the radius and ulnar, and all I'm going to do is supinate as far as I can. Supinate as far as I can. Okay, for pronation, just switch my hands around, and again, pronate as far as I can. You can, if you want to, keep your hand in that position for pronation and supination, as long as you're keeping the radius and ulnar fixed, and you're pronating at the wrist joint itself. done active, done passive, resisted tests, nice and simple. Gonna get you to lift your wrists up like that. Do one at a time, back down. Fix the radius and ulnar, hand again, just superior to the metacarpophalangeal joint. So push up, okay, and relax. Making sure he doesn't dig his elbow in, so he's not elbow flexing. And again, good, and relax. Resisted radial deviation. Again, shaking his hand, fix the radius and ulnar, and this time I want you to push your big finger or your index finger towards that wall. Okay, go. Good, and relax. Same with this side, push that way. Good, relax. For ulnar deviation, I want you to push your baby finger towards that wall. So before I have my hands this way around, just switch and push out. Good, and relax. Again, making sure when they do this, they're not using any rotation of the shoulder, and they're not abducting or adducting. Push your baby finger out. Okay, relax. He's in a pronated position, so we might as well do supination here. Again, it stands to reason if he's going to turn his hand over that way, my resistance is going to be around this area. Fix the radius and ulnar, heel of my hand, and I want you to turn your hand over that way. Go. Good, and relax. Again, making sure he doesn't use his shoulder. And again, go. Good, relax. Turn your hands over. This time, we're going to do wrist flexion. So again, just bring your hand up like that when I say. Fix radius and ulnar. Hand again on the palm, so we're not on the fingers. Pull up. Don't use your elbow or your shoulder. Good, and relax. And again. Good, and relax. Because he's in this position, we might as well now do resisted pronation. Again, stands to reason if he's going to turn over that way, my resistance needs to be around the thenar eminence. Okay, try and turn your hand over. Good, and relax. Try and turn your hand over. Good, and relax. All that's left now is your special test. So to test for decravarians tenosynovitis or tendinitis of your thumb extensor and abductors, this is an active test for the patient to do, so explain it through to them as you go through it. Thumbs towards your baby fingers, make a fist around it, arms out in front of you, and then push down towards the floor. Positive test for that is pain, tension, or discomfort along those two tendons. Anything on either side?
Yeah, both sides.
Okay. That is a positive test, okay, for pain there. What you want to find though is obviously one side to be worse than the other. So if it's just a discomfort on both sides, that's just showing a bit of tension. One side worse than the other is a positive test. Flexion and ulnar deviation. This is a test specifically for your triangular disc. Again, all you're going to do is elbow fix on the bed. I fix the ulnar and radius, flexion, and passively ulnar deviate. And again, you're looking to compress that disc on the lateral side there. Any pain? Again, flexion and ulnar deviation. Anything there? Good. Scaphoid palpation. We did a part of that in the palpations anyway. Again, come off the distal end of the radius onto the scaphoid. Any pain there? And again, through the anatomical snuff box, thumb up. You'll see two tendons appear-ish. Okay, back down. Then palpate through there. And again, any pain there? Good. This side, thumb up. And relax. No pain there. Good. Thumb opposition, you're just looking for your metacarpophalangeal joint line and your interphalangeal joint to actually be able to move. You're also testing your thumb flexors at the thenar eminence. Just bring your hand and your thumb over like that, both sides, and we're just looking for differences between the sides. Okay, looking for any kind of muscle wasting as well. That looks pretty level. Back down. Flexion of fingers. First of all, just each finger just flex to the base of your thumb. And again, I'm looking for differences. That's going to majorly test your metacarpophalangeal joint and your proximal interphalangeal joint. And then flex your finger to the base of that corresponding finger. So again, just coming down, and again, that's now testing the distal interphalangeal joint. So again, if there's any rupture to the volar plates or the collateral ligaments, they're going to limit that flexion. Thumb tests. Hands in mid position between pronation and supination. You've got full movements of the thumb, extension, flexion, ab and adduction, and we're just simply looking to resist them. So finger, hand or thumb on the posterior surface of your thumb, I don't mind, and just try and lift up. Go on, push, 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 good, and relax. Okay, do the other side. This time push your thumb down, good, and relax. No pain. Push your thumb towards that also like that. Good, and relax. If they are too strong, you can do it with your hand, go. Good, and relax. And then try and pull your thumb towards your hand. Okay, and relax. No pain on them. Again, you do both sides individually to check between sides if there's any weakness and or pain. Final test, you're looking for collateral ligaments at your thumb and also your interphalangeal joints of your fingers. And it's nice and simple. You fix above and below the joint you're testing. So I fix above and below the metacarpophalangeal joint. And I'm just going to do a valgus and varus, or ab and adduction at that joint. No pain? No. And then the same can be done for each individual joint, interphalangeal joint, at your fingers, and you work your way through every individual finger. Obviously that's going to be specific if the patient is complaining of pain and or weakness in those particular areas. If they've got no pain in their fingers, you're not going to spend ages doing those tests. And that basically is your hand and wrist assessment.